How do urodynamic studies analyze brain-bladder communication? Imagine your bladder as a smart, responsive organ that communicates with your brain to keep everything in balance. Urodynamic studies are like a detailed conversation between your bladder and your nervous system. They measure how well your bladder fills, stores, and empties, giving us clues about how your brain and bladder work together. These tests look at pressures inside the bladder, how much it can hold, and how quickly urine flows out during voiding. While they focus on the bladder and urethra, they also help us understand the neural signals that control these functions. The brain and bladder are connected through a complex network of nerves and brain regions. Signals from your bladder travel up your spinal cord to your brainstem, especially to a part called the pontine micturition center. This center acts like a switch that turns on the urge to urinate when the bladder is full. Higher brain areas, like the prefrontal cortex, help you decide when it's appropriate to go. These areas can delay or initiate urination based on social settings or personal choice. Urodynamic studies, sometimes combined with brain imaging techniques like functional MRI, help us see how these brain regions coordinate with bladder activity. When your bladder fills, sensory nerves send signals to your brain indicating fullness. These signals activate reflexes that tell your bladder muscles to relax and your sphincter muscles to tighten, keeping urine in. Urodynamic tests measure how well these reflexes work by recording bladder pressure and capacity during filling. If these signals are disrupted, it can cause issues like incontinence or overactive bladder. As the bladder reaches a certain volume, stronger signals reach the brainstem, prompting the pontine micturition center to coordinate the process of urination. This involves contracting the bladder muscle, called the detrusor, and relaxing the sphincter muscles so urine can flow out. Urodynamic studies track the pressure changes in the bladder during this process, revealing whether the brainstem is properly controlling the reflex. Voluntary control over urination involves higher brain centers like the prefrontal cortex. These areas can suppress the urge to go or allow it, depending on the situation. If these brain areas are affected by neurological conditions or treatments, such as those related to prostate health, urodynamic patterns can change. For example, you might see signs of overactive bladder or difficulty emptying the bladder. Sometimes, urodynamic testing is paired with brain imaging like functional MRI. This combination allows scientists and doctors to visualize which parts of the brain are active during bladder filling and voiding. It helps us understand how the brain monitors bladder fullness, initiates urination, and maintains continence. These insights are especially useful when diagnosing complex urinary problems linked to neurological issues or prostate treatments. In the context of prostate health, urodynamic studies are essential for understanding urinary symptoms caused by prostate enlargement, surgery, or radiation therapy. These procedures can affect nerve pathways that control the bladder. By analyzing how the brain and bladder communicate, doctors can distinguish between issues caused by local prostate problems and those stemming from neurological control. In summary, urodynamic studies analyze brain-bladder communication by measuring how the bladder and urethra function during filling and emptying. They reflected the neural control from spinal reflexes to brainstem centers and higher brain regions. When combined with brain imaging, they offer a detailed picture of how the brain senses bladder fullness, decides when to urinate, and maintains continence. This comprehensive understanding helps healthcare providers diagnose and manage urinary issues related to prostate health and neurological control. Always remember to consult a healthcare professional for personalized advice and treatment options.